your dog has started getting up more slowly after resting, hesitates on stairs, or doesn't run on walks the way they used to, this isn't always just aging. Very often, this is joint pain. And the most important question is, what can you actually do about it? Can you stop it? Can joints be restored? And can you really improve your dog's quality of life so they can move more freely and comfortably again? The problem is, most owners take action too late when the process is already well advanced. And at that point, your options become more limited. Hi, I'm Dr. Demi, a practicing veterinarian. In this video, we'll break down why dogs develop joint pain as they age, what early signs you should never ignore, and what's actually happening inside the joint. I'll show you whether this process can be slowed down, how you can reduce your dog's discomfort, and which steps actually help versus common myths that don't. We'll talk about nutrition, weight, activity, supplements, and how you can start improving your dog's comfort right now. By the end, you'll have a clear, simple plan, what you can do at home when it's time to see a vet, and how to build a system that really works. Before we continue, make sure to like and subscribe if you want to better understand your pet's health. Let's get into it. When dogs develop joint pain, in most cases, we're talking about osteoarthritis. This is a chronic condition where the entire joint is affected. The cartilage, the joint fluid, the surrounding tissues, and even how your dog distributes weight when moving. Cartilage works like a smooth cushion between bones. As long as it's healthy, movement is fluid and pain-free. But over time, cartilage can wear down, lose its elasticity, and stop protecting the joint effectively. As that happens, movement becomes less comfortable, inflammation develops, and the joint becomes stiff and painful. And here's the key point: this doesn't happen overnight. In most cases, it develops slowly over months or even years. Modern veterinary medicine treats osteoarthritis as a condition that needs long-term management, not a one-time fix. That means combining weight control, proper nutrition, controlled activity, joint support, and veterinary care when needed. The goal is not just to remove pain for a few days, but to preserve your dog's quality of life long-term. One of the biggest challenges is that dogs are very good at hiding pain. They don't complain, they adapt. Instead of obvious signs, you'll see subtle changes. Your dog may take longer to get up after resting. They may hesitate before jumping into the car. They may avoid stairs, play less, or lie down more often during walks. Sometimes their personality changes too. They may seem calmer, less playful, or even a bit irritable. And many owners think they're just getting older, but very often this is pain. A simple rule: if your dog has stopped doing something they used to enjoy, don't assume it's just age. It may be discomfort. I see this all the time in practice. For example, an adult Labrador comes in. The owner says, "He's just gotten lazy." But when we look closer, it's not laziness. The dog still wants to move, still gets excited for walks, but physically can't keep up the same way. It starts with slower mornings, then less interest in fetch, then avoiding stairs, and only later, noticeable limping. But by the time limping appears, the process has already been developing for a long time. And this doesn't only apply to Labradors. It's common in many medium and large breeds. And even smaller dogs can develop joint issues too. If we're being honest, weight is one of the biggest factors affecting joint health. Extra weight means extra pressure on the joints. Every step, every jump, every movement. Even a few extra pounds can make a big difference for a dog. But here's the good news: weight loss can significantly improve mobility and reduce discomfort. In many cases, dogs start moving better even after modest weight loss. Sometimes owners expect complex treatments, but the first real improvement comes simply from reducing weight. And it's not about extreme dieting. It's about adjusting portions, choosing the right food, and being mindful of treats. Because very often, it's not the main meals. It's the small extras during the day that add up. Joint health isn't just about supplements. It starts with proper nutrition. Your dog needs high-quality protein, balanced nutrients, and the right calorie intake. Protein helps maintain muscle, and muscle supports joints. If muscle mass decreases, joints take on more load. That's why a balanced, complete diet is essential. For many dogs, a high-quality commercial diet is a reliable foundation because it's formulated to meet nutritional needs consistently. Home-cooked diets can work too, but they need to be properly balanced. Feeding by eye can lead to imbalances, even if it looks healthy. For dogs with joint issues, nutrition should support stable weight, muscle maintenance, and overall health. Now let's talk about supplements, because this is where most owners start. It's important to be realistic. Supplements don't rebuild joints overnight. They don't replace proper care, but some can be helpful as part of a broader plan. Omega-3 fatty acids, especially EPA and DHA from fish oil, have some of the strongest evidence for supporting joint health and reducing inflammation, but they need to be used correctly. Fish oil adds calories, and not every dog tolerates tolerates it the same way. Dosage should ideally be discussed with a veterinarian. Glucosamine, chondroitin, and MSM are also commonly used. Some dogs do benefit from them. Owners notice easier movement, less stiffness, and better comfort, but results are variable and usually take time. The biggest mistake is expecting instant results or using too many products at once without a clear plan. The best approach is to choose a structured strategy and evaluate real changes in your dog's movement and comfort over time. A very important point: complete rest is not the solution. Joints need movement, but the right kind. If a dog becomes too inactive, muscles weaken, and weaker muscles mean more stress on the joints. So instead of removing activity, we adjust it. Shorter, more frequent walks are better than long, exhausting ones. A steady pace is better than sudden bursts of activity. Avoid excessive jumping, sharp turns, slippery surfaces, and high-impact play. In some cases, controlled activities like swimming can be helpful if recommended by your vet. A good rule: if your dog feels worse the next day, the activity was too intense. Small changes at home can make a big difference. If your floors are slippery, your dog has to work harder just to stay stable. That adds stress to joints. Adding rugs or traction surfaces can improve confidence and reduce strain. If your dog jumps onto furniture or into the car, consider using ramps or steps, not because they can't do it, but because each jump adds impact to the joints. Make sure their bed is comfortable and supportive, not too thin or hard. And don't forget about nail length. Long nails change how the paw contacts the ground and can affect joint alignment. These small adjustments add up over time. If your dog is limping, clearly in pain, avoiding movement, or showing sudden changes, don't rely only on supplements. You need a proper diagnosis. Joint pain can come from arthritis, but also from injuries, ligament problems, spinal issues, and more, and treatment will depend on the cause. A veterinarian can evaluate movement, joints, muscles, and overall condition, and may recommend imaging if needed. Also, never give human pain medications to dogs unless prescribed. Some of them can be dangerous. Let's make this simple. First, observe your dog closely. Look at how they move, get up, and behave during daily activities. Second, assess weight. Even small reductions can help. Third, review their diet. Make sure it's balanced and appropriate. Fourth, talk to your vet about joint support, including omega-3s or other supplements. Fifth, adjust activity. Don't eliminate it, but make it safer and more consistent. Sixth, improve your home environment, reduce slipping, limit jumping, and support rest. And finally, if you see signs of pain or limping, don't wait. Get professional advice. Joint problems don't start suddenly. They develop gradually, and you have a choice. Ignore early signs or act early. That choice can mean the difference between years of discomfort and years of comfortable movement. Often, it's not one big change, but a combination of small, consistent steps that makes the biggest difference. This video is for educational purposes only and does not replace professional veterinary advice. If your dog is showing signs of joint pain, stiffness, or limping, make sure to consult a veterinarian. If you found this video helpful, like, subscribe, and let me know in the comments if you've noticed any of these signs in your dog. I'm Dr. Demi. Take care of your pets, and I'll see you in the next video.